When you talk about productivity, it's so much more than cost. And a lot of times that's the concern when we talk about productivity is that staff feel like, hey, you're only worried about the money. You're not worried about the consumer or their outcomes or the reality of what's happening for them. So we want to make sure that everybody understands direct service production is the ability to have capacity. Without capacity, then that means I don't have anywhere to put someone. Has anybody out there ever heard the words, the caseloads are full? Because I hear it all the time. And especially when we're doing work on same day access or just in time prescriber scheduling, it's, there's nowhere to put people. We need to do something different. And that's because, again, we don't have the right level of capacity. So without capacity, I can't get people in a timely manner. And if I can't get them in a timely manner, then the show rates go down. And if the show rates go down, then the treatment outcomes normally go with them because if they're not here, I can't help them. And so when you look at that, it ultimately generates a higher cost as no-show rates increase. So I can't fund the system changes that I need. And I ultimately end up with staff or clients that are not satisfied, and so they leave. And so just to make sure everybody understands, the things we're going to be talking about today, they're all linked together with your ability to have a healthy system that can help consumers get better and get to better outcomes, but also to make sure that your staff are happy and you can help retain them. So that's really what it's about. And kind of a reframe, if you will. Productivity is not a measure of how hard staff is working. Productivity is a measure of how well our systems are working to support our staff. And that's where things like collaborative documentation and the advent of AI and all that it's able to do now really help us to be able to go in and impact this because if we have the right systems, then we're able to support our staff and to keep our staff.